Viral epidemiological attacks are among the most dangerous challenges that humankind has faced from time to time, and despite the great development and tremendous progress in the field of medicine, we are still exposed to new viral patterns and strains that have been posing major challenges for doctors and experts, and the most prominent of these viruses that appeared in the few years past is coronavirus, which is attributed to one of the severe diseases and syndromes called Middle East syndrome or corona disease. Coronavirus is actually one of the most severe types of viruses that target the respiratory system of mammals, among them humans, and is the main cause of many serious diseases such as acute pulmonary syndrome and Middle East syndrome, corona disease known as MERS-CoV, that have appeared over the past few years. Coronavirus is of animal origin, meaning that the infection is transmitted from humans through animals and then between humans themselves. Studies have shown that bats are the original home for the emergence of the virus, and that it has been transmitted to mammals, mainly camels, long ago, then to humans through direct and indirect interaction with the mammals carrying the virus. Middle East syndrome, or what is known as corona disease, first appeared in 2012 in the Kingdom of Saudi Arabia at the time that the coronavirus spread in the region, and studies have shown that the virus mainly targets the respiratory system of patients, in particular epithelial cells that are not exposed to the endothelium of the respiratory tract. Although most of the viruses that infect the respiratory system target the epithelial cells fringed, and this is what distinguishes the coronavirus and narrow the spread of the virus, because infected non-fringed cells make up only 20% of the respiratory system. Corona causes and risk factors. As mentioned earlier, the underlying cause of the disease is the coronavirus itself, and the primary source of the virus is camel, so direct contact with beauty, exposure to breathing air directly, and ingestion of one of its products, milk or undercooked meat, carries a high risk of transmission the virus from it to the human. Reports also indicated that there are cases of HIV transmission among people, especially among healthcare workers. Increased risk factors, increased chances of infection and transmission of the coronavirus in patients with some chronic conditions, including chronic diseases such as diabetes, chronic pneumonia and heart disorders. Young and elderly patients. Cases of organ transplantation, in which patients are subjected to immunosuppressive drugs in order to ensure that the body does not reject the new implant. Take immunosuppressants to treat autoimmune diseases. Patients with a weakened immune system, especially cancer patients who undergo radiotherapy and inhibition. Symptoms caused by the coronavirus. Corona disease falls under the category of influenza-like illnesses, with symptoms and signs of pneumonia. Reports have shown that early symptoms of the disease are very similar to the symptoms of SARS, acute pneumonia, and the main common symptoms of the disease include fever, persistent cough, shortness of breath and shortness of breath. In addition to some accompanying minor symptoms, which include shudder, chest pain, sore throat, a headache, diarrhea, nausea and vomiting. Coronavirus diagnosis. Coronavirus infection is usually diagnosed through a pathological story, in particular by asking about travel to one of the areas where the infection previously spread, as well as asking about exposure or interaction with a previously infected patient with corona disease. It includes tests that help diagnose the virus such as a blood test, coronavirus antibody, and saliva test, as well as a respiratory sample and RT-PCR testing, which gives positive results if a coronavirus is present. Test samples are usually taken 10 days after symptoms appear, and if negative test results persist until day 28 of the symptoms, the patient is considered healthy from the coronavirus. Coronavirus treatment and prevention. Unfortunately, medical research has not yet succeeded in developing a cure or a vaccine for the virus, and treatment is limited to symptomatic treatment and the alleviation of symptoms in the patient, but the efforts of scientists are still ongoing to find it, and on the other hand there are several rules that can be followed in order to avoid catching a virus corona. We cite these rules. Wash hands with soap and water for 20 seconds, and educate children to do so as well. In the absence of water or soap, hands can be disinfected with alcohol. Use tissue when sneezing or coughing and throw it directly. Avoid touching the eyes, nose, and mouth, especially when cleaning hands is not guaranteed. Avoid direct interaction with the injured, especially by sharing clothes and tools. Clean frequently used tools and areas, such as door and window handles, because they are the most common places for the presence of the coronavirus.